Hi, everyone, and welcome to the Community Engagement Series. My name is Priscilla Medeiros. I'm the Knowledge Mobilization and Community Engagement Specialist at the Edwin S.H. Leong Center for Healthy Children. I am also your moderator for today and very excited to welcome our speaker, Dr. Notisha Massaquoi. Dr. Massaquoi is currently an assistant professor in the Department of Health and Society at the University of Toronto Scarborough campus, with cross appointments in the Faculty of Social Work, as well as the Department of Family and Community Medicine with the Temerty Faculty of Medicine. She's also the founder and director of the Black Health Equity Lab, which conducts community-based health research and works with Black communities to develop advocacy tools, strategies, and programs to improve health outcomes, well-being, and success in Canadian systems. Her early health leadership career established several health service organizations which serve Black communities in Canada, and she's developed and served for 2 decades as the Executive Director of Women's Health and Women's Hands Community Health Centre in Toronto, the only community health centre in North America specializing in primary health care for Black and racialized women. I'll now hand it over to Dr. Massaquoi.
Thank you so much, Dr. Medeiros. It's an absolute pleasure to be able to present today, and you've given me a challenging topic to focus on within an hour. And what I'm hoping to do today is really introduce some concepts that I hope people will take away and spend some more time thinking about how they can incorporate them into their own research as they're thinking about working specifically with Black communities, or at least participating in solidarity with Black communities and Black researchers. So I'm going to share my screen, and when I share my screen, I understand that I cannot see everyone. And so if you have questions throughout the talk, if you could put them in the chat, and Priscilla has promised to moderate the chat for me, and we'll take up some of those questions at the end. I would first like to start with offering a land acknowledgement. I am originally from Sierra Leone, and I'm from the Mende people of Sierra Leone, and I'm visiting this land and have the pleasure and opportunity to work on this land. So as a person of African descent, I offer this land acknowledgement in recognition and in solidarity with Indigenous peoples in the efforts and deliberate intentions towards decolonization. I acknowledge that we are situated on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and now home to many diverse First Nations, Inuit, and Métis people. As a person of African descent, I recognize my ancestors who were brought to this land by force through the transatlantic slave trade, and I recognize the historical colonialism and ongoing colonialism that has led to the present day situation where we offer land acknowledgements to Indigenous people instead of actual returned land. As a person of African descent, I acknowledge the land of Turtle Island that sustains us, and I express my deep gratitude to its Indigenous peoples and honor the dignity of Indigenous people. I understand that my work to end anti-Black racism cannot occur at the expense of Indigenous communities and Indigenous people. So just in case I lose people in this busy world and you leave before I finish, or some technological malfunction happens, I'm going to tell you what the end of this presentation should bring for you. And I like to start with the conclusion so people understand where I'm going in talking about engagement with Black communities and conducting ethical research with Black communities. It's very important that we all leave today with the understanding that researchers who hold themselves accountable to Black communities, immerse themselves in understanding systemic anti-Black racism, and commit themselves to our survival and well-being will be the most successful in their work with and for Black communities. Oftentimes people think about doing their research from an anti-oppressive lens or acknowledging anti-Black racism is sufficient. What we're actually asking you to do is engage in a process of accountability to Black communities. The only way you'll know your research is effective with Black people, or if your research is not harming Black people, is if you ask Black people, right? Only Black people can tell you, right, how well you're doing. That's accountability. It also requires that you deeply understand what systemic anti-Black racism looks like in Canada, particularly in the research realm. And your work has to be work that is committed to our well-being and survival. Right? When we experience your research, or we see the results of your research, how does it assist us in improving our experience in the Canadian system, right? And guaranteeing our survival and well-being within that system. So that's the end. And for every talk I give, no matter what the topic is, this will always be the conclusion. So if you come and see me again, speak somewhere else, you'll know what the conclusion is. I'm hoping there's a day where this will need to be said, that this no longer, I'll have a different conclusion. But for now, this is my standard conclusion whenever I'm talking about Black people and Black communities. I'm the founder and director of the Black Health Equity Lab. I'm really excited about this lab. I started it when I joined the faculty of U of T in 2001. Oh, I'm saying 2001, 2021. And it's a mixed methods research lab, which conducts community-based research in collaboration, not even just partnership, in collaboration with Black communities to develop advocacy tools, strategies, and programs to improve health outcomes and well-being and success in Canadian systems. It's not just about identifying what our barriers are to accessing services or identifying the disparities. At the end of the research that we conduct, Black communities have to be in a better place than when we started conducting the research. And it's really important that we develop solutions. So we're a very solution-focused lab. I'm really excited to be able to provide this opportunity for students at U of T so that they get to learn very early in their careers and in their academic studies how to work effectively with Black communities, which is something I had to learn later, much later in my career. It's not innate that just because I'm Black and I'm a Black researcher that I know how to work with Black communities well. It's something that I had to learn and develop and practice. So this is an interactive part of the presentation today. I have a question for the audience, and if you could put your answer in the chat. So my question to you is, what did you learn in school about the contributions of Black people in Canadian history? And my language is very specific. So what did you learn about what Black people contributed to Canadian society? And if you didn't go to school in Canada, that's fine. What did you learn about Black Canadian history in general, or Black people in Canada in general? And if you could quickly put your answer in the chat. Now, I'm not psychic. I actually don't have to go look in the chat. I'm pretty sure I know what's going to be in the chat in terms of some of the responses. Priscilla, what are some of the responses that people have put?
I see a lot of responses. This was not taught, nothing. I can't recall learning anything when I was a kid, very little. So definitely a common thread in the response that folks have not learned much to anything on this topic.
So if you're educated in Canada, and if you think about your entire education process in this country, whether it's from primary school all the way up to graduate school, you would have essentially learned very little about contributions Black people have made to Canadian society. I want you to understand, as researchers, even as a Black researcher, you're going into research with Black communities with very little knowledge about who they are in this country. You're going into the research with very little understanding of the history of Black people in Canada. Before you go to engage with Black communities in research, that's the first thing you have to understand, how little you actually know. And you're not even going in with a positive mindset of valuable people contributing to society. So what we learn in the Canadian education system is, one, Black people are not valuable because people who don't contribute are not valued. they're not valuable. And when they're missing from your world, your space, your community, your classroom, your research, no alarm is going off. The valuable people are missing. Or if they're being harmed, there's no alarm going off, right? The valuable people are being harmed. So I want you to understand that that is a positionality that as a researcher, you have to disrupt. You have to intentionally disrupt. And you have to fill, right, the knowledge that's missing before you begin working with Black people, before you come to approach us to engage in your research or to be part of your research. What do you actually know about us? And how are you positioning us differently than how we've been positioned in your education? Right? What do we really understand about communities? And when you have a very limited engagement or understanding of a community and its history in a particular location, you'll have this very surface. This is an iceberg. An iceberg is massive, right? But the bulk of an iceberg is actually below the water. So we think we have this huge understanding of people when we really just have a surface understanding. And what we really need to learn about is what's below the surface. And if you don't know what you don't know, right, you're not actually often designing your research to actually answer questions that are below the surface, the things that really matter to Black people and Black communities. Three things to help fill in some gaps very quickly. And I call these non-negotiable, non-debatable facts. They're facts that I personally am no longer going to be bringing data to prove to you that these things are real for us as Black people. But they're really foundational in understanding how you need to think about the Black experience in Canada when you're conducting research with and for Black communities. First, non-debatable. We have to recognize that Black communities in Canada function within a society which is anti-Black in very specific and deliberate ways. Very harsh statement. We don't have a pro-Black society. We're not working in a pro-Black system. We're working in a system that's working against Black people. When the British and French arrived in Canada to colonize this space that we're calling Canada, three things happened for Indigenous people: the containment of Indigenous people, right? Those that can't be contained, expelled, so the expulsion of Indigenous people, and then we go into extermination. We just have to look at the residential schools and all the graves of the children, right? So we understand those three things are the project of colonization. When the British and French arrived in Canada, they arrived with enslaved African people. We experienced the same thing. We're the first racialized group to arrive in Canada. We experienced the same three impacts of colonization: containment through slavery, expulsion when slavery ends, and extermination. All societal systems in Canada do these three things to these two populations. Constant exposure, because of how our systems are set up to do these three things to these two populations, which is the foundation of Canada. So constant exposure to racism and social exclusion are linked to Black community disproportionality in all societal systems. There is no societal system where we're excelling, where we're having positive outcomes. Education, 31% of all children expelled from the Toronto District School Board are Black when we only make up 12% of that school board. 41% of all children apprehended by child welfare in this city are Black when we only make up 9% of the population, right? Expulsion, containment, extermination. You're 22 times more likely to be killed by a Toronto police officer if you're Black in the city. So just to give you a sense of, I can walk you through every societal system and show you that it's doing one of these three things to Black people. Third, non-debatable. There are clear indications that Black communities experience broad health disparities due to the anti-Black racism that they experience. We have the highest rates of the stress-related illnesses, hypertension, heart disease, diabetes. And we think about trauma and mental illness and mental health conditions that Black people are struggling with. We're the only population where you can watch a full murder of our community member from beginning to end televised repeatedly. social media. We can't get away from the level of trauma and fear that's inflicted on us daily, just through what we have to endure in terms of watching what happens to our community members. These three things are very foundational in your understanding of working with and for Black communities. And if you don't have a strong understanding of these three things, it becomes difficult to actually engage effectively with our communities. We also have to think about research ethics and legacies of harm caused to Black people and Black communities through research. And we often tend to go to the US and we talk about the Tuskegee experiment, Henrietta Lacks, and we'll pull these American reasons why Black people have a distrust of the research space and the research arena. But we can absolutely look here in Canada. And I've given you three examples that I've experienced personally. I was a student in the 80s at Western University as an undergraduate student, and the university upheld the work of Dr. Philip Rushton. And he was a eugenicist who taught about the inferiority of Black people through our brain size being larger, therefore indicating intellectual inferiority. He measured genitalia to talk about enlarged genitalia of Black people and its association with intellectual inferiority. And I can go on and on and on about Dr. Philip Rushton. The university upheld his research. It passed ethics up until at the time that he died. So many, many, many years. And as students, we protested outside of his classroom on a regular basis to ask that he be removed. And the response from the university was, if we silence him, what if he's correct? What if his research is correct and we silence him? Right? So academic freedom was used to support Philip Rushton. As a young social worker at the height of the HIV pandemic, prior to having medication for HIV, all of my clients died. My whole caseload died. So when AZT came out as that first drug, I get our clients on AZT, not knowing that that drug had not been tested on Black people in the clinical trials. And Black people had very specific side effects to AZT. And you can read more about some of those side effects specifically attributed to not having tested the drug on Black people. And then we have the mother risk situation from Sick Kids, in which hair was tested for indication of drug use on mothers, and that the test was faulty, and that Black and Indigenous mothers were the ones that predominantly lost their children to child welfare because of the false positive tests. So these are some of the experiences that Black people are very, very aware of and understand when ethics failed, or when researchers failed, or how research has been used inappropriately to harm Black people. Those are things you need to be aware of and understand that our hesitancy to engage with research and researchers is a legitimate hesitancy. It comes from absolute history of harm caused by research. So one of the things we want to think about is, how do we guarantee, right, ethical engagement with Black communities? From a standard ethics perspective, the core principles that we think about when we're designing research and when we're engaging in ethics is respect for individuals, beneficence, and justice. Now, these three things have to be a part of how you design your research, but they're very much looking at protecting individuals, and rightly so. For Black communities, we have to be protected not just as individuals, but also as a whole community. And so something I'd like to add is for you to think about the ethics of representation. And when I talk about the ethics of representation, what I'm really thinking about is that representation has consequences for Black people. How people are represented in your research will ultimately be how they are treated. And you have to really think about how Black people are represented in your work. Now, if they're absent, that also tells us something, right? As we know from learning in school, the absence of Black people perpetuates the okaying of the absence of Black people. But representation is something that you have to think about as a core ethical principle. Representation is about the ethics of accountability and responsibility towards Black people and Black communities. And so you have to think about the whole entity of us as a community when you're engaging in research. So not only are you not to harm the individual, your research cannot harm our community. So some things that I know for sure. I stole this from Oprah. If you've watched the Oprah show, she always talked about what I know for sure. We've spent a lot of time developing our goals and objectives in research. And what I encourage you to think about is, what is your intent? And, when I get approached to partner on research projects, or to engage community, to help with community engagement, I always ask the researcher, what is your intent? Especially if they don't identify as Black. Because if my intent in my research is to guarantee the survival and well-being of Black people, that has a different meaning than I want to look at the barriers that Black people are experiencing when accessing the healthcare system. And so I really encourage you to think about your intent. And when you're approaching people and communities to work with, that you tell them explicitly, what is your intent, right? Who are you as a researcher? What's your ultimate goal, really, for this community? Not for you, not for your tenure, right? Not for your academic success, but what is your intent as a person? In the African context, we talk about the Ubuntu. I am because you are. I exist because you exist. And the humanity in me can see the humanity in you. So when I'm talking about intent, I want to know how you see me and how you see my community. Hold yourself accountable to the community you study. So what are the mechanisms that you've put in your research that allows for community feedback, specifically Black community feedback? And is it something that shows up at the end, or is it something that is throughout your whole process? Is it at the beginning when you came up with the idea and the concept? Like, what are the accountability mechanisms that you've put in place in your research to guarantee no harm will be done to this community at the end, that they understand what your intent is, and that you're walking the talk through the project? You have to give more than you take from the community. And this goes for any marginalized community. When we're engaging in research, we want to make sure that the information that we're extracting results in something that is greater than a paper, that's greater than a conference presentation, that's going to leave the community with something to guarantee its well-being and survival in Canadian society. So you want to think about, what does this community receive when my research is finished? What do I leave this community with? And what are the tangible benefits for the research participants? There's an honorarium often, there's a gift. We understand those things from a research and ethics perspective. But I always think about, when I ask participants or community, what is the most tangible thing that I could provide you at the end of this study? Sometimes I get surprises. In my doctoral research, I was looking at African refugees who are claiming status based on their LGBTQ identity. And yes, bus tokens were given. Yes, honorarium were given. But what they asked me for was my expert testimony in their hearings. Surprise. That's not what I set out to do. That's what I had prepared to do. But they would participate in the study. They would give me all the information that I needed if I could then as an expert witness, present that information in their hearings. So sometimes those tangible benefits aren't things that you think of, but when you're working collaboratively with a community, you have to be prepared, right, to understand what benefit means for them. I also want you to think about your research as an intervention strategy to address anti-Black racism. So once we understand what our intent is, what our objectives, what our goals are, when working with Black communities, right, our research has to be part of the strategy to address marginalization and their marginal status. To do that, we have to think about Black community members directing and building foundational research for their own community. So how are you assisting with that process and that need? We have to facilitate and create equitable partnerships with Black communities and academic institutions. Right now, there are lots of regulations and things in place that make it difficult to engage in equitable partnership. It's just simply the time it takes to reimburse somebody for their honorarium when they participate as a subject, is not helping with the equitable relationship that we're trying to engage in. But you also have to look at what are the means, what is the privilege, what is the power that I have to actually push my institution to change, right? So that I'm actually not disadvantaging communities when they participate, or Black-led organizations when they participate. How are they being compensated for the staff time to help you conduct your research and not deliver service in that organization? So thinking about how we really think about equitable partnerships. UTSC has a wonderful framework that they're about to release next month to help us think through what equitable partnerships would look like, particularly for marginalized communities. And then our research has to translate into political action, right? So it's not simply letting us know how marginalized we are or what our disparities are. How are we going to change that situation? And, this is why community-based research becomes really, really important in the work that I do, because it does allow for that flexibility for me to translate my research to engage in political action. What does trust have to do with any of this? Trust has to be front and center of your understanding of how you're going to work effectively with Black communities. These are all studies that I've done over the years. And no matter what the study is, and I predominantly am a health researcher who's looking at the social determinants of health, looking at the impact of anti-Black racism on Black communities and their health outcomes. But no matter what the study is, trust is a core theme that will come up with Black community. Racism as a determinant of health for young women was a study where we engaged in participatory action research with young racialized women to find out what their experience was in the healthcare system. They were having such racist experiences at a very young age that they would disengage from healthcare, and therefore only showing up in crisis later, right, in their 20s, in their 30s, because they had disengaged from the healthcare system very young. So the lack of trust that they have in the system actually impacted their health outcomes. Sisters, mothers, aunties, daughters was helping Black communities start thinking about an HIV vaccination when we had one. We already knew that there was so much mistrust of the system and vaccinations that we know that when an HIV vaccination comes, and we already actually got a taste of this with COVID, people aren't going to rush for a vaccination if I don't trust the system or the person giving me the vaccination. In this study, about 70% of the women said that they did not trust their family doctor in terms of vaccination for HIV. They, in fact, felt that they would be injected with HIV, that they would be harmed by the vaccination. And so it helps us think through, what are some of the challenges in terms of conducting research with a community that already has mistrust of the research realm, the research world, and the health system. So trust is something that you have to develop. It has to be part of your engagement, right? How am I going to ensure that this community trusts me? A lot of it is reputation, right? When a researcher who's not from the Black community wants to work with me, I ask them to show me their research. And what have you done so far with Black communities in mind that helps me understand what you're going to do with me? And if you haven't, right, then how are you going to compensate for the information you don't know about, things you don't know, and what you don't know about us, and how are you going to be a benefit to our community? If we think about, health access research, and this is a lot of where my research takes place, as Black people, we have particular health issues that may, show up in our community specifically. But, culture and race will determine maybe when I understand myself to not be well and what kinds of things I might be dealing with. But anti-Black racism determines when I'm going to leave my home to seek assistance. And it's going to determine who I trust. It determines where I go first. And we have this perception that once we identify that we're not well, we're going to take this straight path and access healthcare services. And that's not what's happening for Black people. What's happening for us is we come off the path very quickly at the beginning, right? Who do we trust? Where do we go first for information? It might be pastor, might be friend, might be internet, might be a whole lot of other places than on that straight path to the healthcare system. In this city, where you live as a Black person heavily dictates how much access you have to health services. In the neighborhoods that have the highest population of Black people, they have the lowest actual health services. We have to travel quite far. Do I have the resources to travel quite far to that service? Anti-Black racism is going to determine what mode of transportation I take. It's going to determine even if I get paid time off to go, what kinds of benefits do I have? And all of these boxes with the question marks are all the spaces that we're going to before we get to that healthcare system. Research that is really engaging Black people happens in those boxes. It's about finding out what's in those boxes. Where are we going and what's happening inside those boxes? And those are the spaces where you really understand how our system works. Because our health system is not one that is effectively addressing the needs of Black people, how am I supporting the work that's happening in those boxes, in those spaces? How's those boxes? How is my research advocating for changes in that healthcare system that Black people are not getting to? And if that Black person gets to the healthcare service, there's a border there. So oftentimes the intake process is one that is lengthy, is not conducive to the needs of Black people. There may or may not be someone who speaks your language when you get there. And so there's a barrier even before you enter the system. And if you get into the service, are there people who look like you providing that service? Right? What's the quality of that service and how are you sent back home? Anti-Black racism determines all of those things. I'm giving you this summary of my research in a nutshell, in a diagram, to help you think about, the ways that you engage a community. It's really understanding, right, their pathway to engage in society, in Canadian society, and what are you doing at each part of this journey to ensure that Black people are successful, right? How is your research supporting, right, that journey? One of the tools that we have available to us comes from the Black Health Equity Working Group, and we refer to these as EGAP principles. And it's a data governance framework for healthcare data, how to manage, how to take care of healthcare data for Black communities. And the principles of EGAP, and I encourage you, if you've not heard of it or you've not engaged with it, are engagement with Black communities, effective engagement, the governance of the data. So who governs the data that you may have about Black people? Do Black communities have access to your data, right? And how do you make that access seamless and not cumbersome? And how are you protecting the data of Black people? That representation piece, how we are represented is how we are treated. And so I would encourage you to take a look at this framework as one that you could adopt and engage with to ensure that when you're collecting data with Black people in mind, with and for Black people, that you're following these principles. I had the privilege of working with Dr. Mona Lutfi at Women's College Hospital, and she was collecting data on women nationally living with HIV. And she has a large cohort of Black women in her data set. And one of the things that she did as a researcher is transfer that data to my lab to ensure that Black women in particular living with HIV have governance, engagement, access, all of those things in place with that data. It's an enormous data set. It's over 500 women. And, as a white researcher, I think it's important when you have access to large data sets nationally, and not just white, I would say someone who's not identifying as Black, when you find cohorts that large of Black data, how are you connecting with community to ensure that that data is protected and something is done effectively with that data to help the community? So I'm very honored to have gone through that process with Dr. Lutfi and Women's College Hospital in terms of the transferring of that data into the hands of community directly, which is now going to allow us to develop a process of how to access the data and develop some understanding of Black women nationally living with HIV. You want to think about your role to play. And I think about the research system as an ecosystem. And it's not just your role as a researcher, right? What about the institutions we sit in? Ethics boards, funders, right? There's all aspects of the ecosystem that we often have a ability to influence. So some of the things that you should be thinking about, whose voices and perspectives are prioritized in your research? Is there a clear understanding about the history of racism in research and the long-lasting impact with communities, particularly Black communities? Are you thinking critically about how race is used in research protocols when making decisions? Or are your protocols racially neutral, which is what we see a lot, right? So we have to think about how race is taken up and thought about, right, when you're designing your research. And is there intentional representation of Black community members in all of your decision-making processes from beginning to end? One of the things that will annoy me as a researcher is when you ask me to participate in your research as a partner. And oftentimes it's after everything has already been developed, right? Or it's oh my gosh, got to write that EDI statement for this funding. Let me sort it out. Let me go find somebody. Or you're thinking about me in terms of your recruiter, right? Who's going to recruit the Black people for this study? All right. And it's really about the respectful ways that we get engaged in research and when, right? When you started the engagement. It actually should start before you even start the study, right? So don't wait until you're doing the study and then start engaging with diverse populations, right? What are the relationships that you're building before there's a study to even think about, so that you're doing it in true collaboration with communities. It's also important, and I'm speeding through a lot of things only because I want to give you a taste of what you should be thinking about further. But one of the things you want to think about is recognizing the potential of your research to support communities, right? What is the potential of your research to support Black communities? And we as a community understand, right, how valuable research is for our success, because there's such limited information that when people are engaging in research and producing information about Black people, it becomes extremely valuable. So you want to think about the potential of your research to support the community. You want to guarantee that you're thinking about not harming, do no harm to Black communities. As researchers, we're conditioned to do no harm to our participants. And I want you to think about the Black community as a participant. How do you show respect and accountability to Black communities? Right, and a lot of it has to do with that initial engagement before you start the research. Right, what is the relationship that you're building? And what does respect look like for Black people, right? You have to ask them, right? What is respectful engagement and what is accountability? Oftentimes people don't take that time to find out what we feel respect looks like. You want to outline really intentionally your community engagement plan and your partnership plan with Black communities. And for those of you who are researchers in institutions, you want to think about the plan, like I said, before you start the studies. So does your lab or your research program have an actual partnership plan for Black communities? And what would that look like? And I also want you to think about the development of those plans and those principles with Black communities, right? It's nice. I am engaging in a study right now where we're going to be looking at developing a research agenda with Black communities. So I even have, what is my plan? What is my engagement plan? What is my partnership plan going to look like? What are the principles that I'm going to actually espouse? And I'm thinking about, how do I develop one for my lab so my students also have guidelines to follow, right? When working with Black communities, these are the things that need to be in place. You want to also think about, how do you address the political relevance of your research to the Black community? Is it relevant now, right? What are their priorities right now? You want to think about identifying risks and benefits, right? We have to do it for ethics. What are the risks and benefits for Black people? Not just general risks and benefits, right? What are the risks and benefits that Black communities may experience in my research? What's the dissemination plan, right? Oftentimes I see lots of data that never reaches Black communities. And then you're telling me about disparities and things that we have to think about, but the general Black population doesn't even know what their risks are for certain health conditions, for example. So how is this information being disseminated? Data accessibility and ownership. That's always a tough one as researchers. Who owns the data? How do we make it accessible? How do we put it in a format that's accessible for communities? And then thinking about panels and tables of experts in Black community research that can actually advise. So how do you put those together? Or how do you work with existing tables to make sure that your research is absolutely accountable, right, and respectful to Black communities? Anti-Black racism in research isn't only about what we do, it's also about what we don't do. And we know the challenges that we have because we do not collect race-based data. We do not data in Canada, but specifically race-based data. And that lack of race-based data actually renders Black community experiences invisible. It's really important that as Black community members are advocating for the collection of race-based data, particularly in the health realm, that our colleagues are allies with us, that you also understand that the lack of race-based data is very detrimental to our community. And so part of your advocacy is that, in terms of advocating for the collection of this data, but also thinking about how you can contribute to the collection, and then what do you do with that data once it's collected. So race-based data really for Black communities and engagement with our communities really helps us understand disparity and disproportionality. These are the proportions, percentages of Black people in different aspects of the local community in Toronto, Ontario, our province, and our country, Canada. So we understand, right, what I don't have to tell this group what disparity and disproportionality is measuring, but, just to give you some examples, if we look at Black representation in Canadian universities, we see that once we get to the doctoral level, our participation drops. And once we get into full-time faculty, right, it becomes almost negligible. So if you think about colleagues who are engaged in research and at an academic level, you could see how our numbers are dwindling. And then when we get into senior university leadership roles, we're very absent. The same thing happens in the hospital system. If we look at governance, right? Who's governing and who's making decisions at the hospital level? If we are 3.5% of the Canadian population, but only make up 1.9% of board members across the country, or we're 9% of Toronto and we only make up 2.9%, you understand, right, what our absence is doing in terms of the systems that we are trying to affect. We're not in those spaces. Just to give you an example of disparity and what should happen when we see these kinds of numbers. When we started our HIV work at Women's Health and Women's Hands Community Health Center, we primarily serve Black and racialized women. We were seeing high rates of HIV with women. And it came to our attention that Sick Kids, which is the hospital where HIV positive babies and children are treated, had a prevalence rate of 90% of all babies that were HIV positive were born to Black women. 90%. The disparity should be a directive, right? So it's not just telling me what the disparity is. It should be, what is our research priority? It pushes it. And then what do we do? So it's not just research why it's 90%. It's how do we reduce it? So we teamed up with Unity Health, the Positive Pregnancy Program. In the middle, Jay McGilvery is the midwife with that program, and Dr. Mark Uden is the obstetrician. In the picture with her are Lori-Ann Green-Walker, who's now the executive director of Women's Health and Women's Hands, and Wangari Thoreau, who's the research director. And we partnered together to come up with not only to understand why that prevalence rate is so high, but how do we reduce it? How do we guarantee that in the world, if the prevalence rate is 90%, that's not going to be our prevalence rate in our health center? I won't go through the details of that partnership, and if anyone wants to hear more, I'd love to talk about it, because they have now, in a population that has the highest percentage of women in any clinic living with HIV, they have delivered no positive babies in about over 400 deliveries since that program has started. The directive is what drove us, right? The disparity is what drove us, right? So it's important that your research, right, reduces the disparity. What happens when we don't pay attention to the disparity as researchers? We all know about COVID. We're in it still. And we also know about the prevalence rates of COVID, right? 83% of all people in the city of Toronto who contracted COVID, especially at the beginning of the pandemic, were racialized, with the Black community having the highest rates of COVID acquisition. So we knew which community had the highest rates of COVID, right? We made up 9% of the city. At this collection point, 21%. We went up to about 23%. We had about 26% of hospitalization because of COVID, highest rates. This is what it looks like if we mapped it in the city. So the darker the red, the higher the prevalence rate of COVID in the neighborhoods of our city. If I take this map and I place it on top of a map of the Black communities in Toronto, the darker the brown, the higher the Black population is in that neighborhood. I could put that map of COVID on top of this one, and you see it lines up perfectly. If I take those two maps and I put it on top of this map of density in our city, the darker the brown, the higher the density, the higher the Black population, the higher the rates of COVID. If I take all of those maps and I place it on top of this map of our subway system, the dots are where the subway ends. The dots end just before every major Black neighborhood in our city. That's where the subway ends. If I take all of those maps and I place it on top of this one, when we got vaccinations in our city, they were distributed first through corporate pharmacies only, Shoppers and Pharmacare. That was the policy, had to be in a corporate pharmacy. These are all the pharmacies. These are where the corporate pharmacies are. Corporate pharmacies, the darker the red, the higher the COVID rate, right? And think about all those maps, where the subway ends, right? Highest populations of Black people. When we rolled out the vaccination, we started at age above 65 first, and then we rolled down. I'm not going to tell you my age. I was waiting for that roll down so I could go get my vaccination. That makes sense for the general population, but only 7.6% of the Black population is over 65, the population with the highest rates of COVID. 60% of the Black population is under 30. Children are extremely important to focus on when you're doing research with Black people. We are a very young population. You can see, right? The alarm didn't go off. The valuable people were not alerted. And each one of those maps is a decision point, right? Each one of those maps is research that could have actually helped prevent, right, unnecessary high rates of COVID deaths for Black people. So, you know, just to wrap things up a little bit, I just wanted you to understand, right, the urgency of engaging effectively with Black communities in our research, right, and the value that you can bring to the community in terms of research that includes us, is conducted with us, and conducted for us. One of the things that I learned quite a bit from working with Women's Health and Women's Hands is, you know, the prevalence rates of chronic illness. And one of those is HIV, and 33% of Black communities diagnosed with HIV in Ontario live in the Eastern GTA. The maps that I just showed you, you can actually see, you'll see high rates of HIV in there. So the research question that we came up with collaboratively with community is, what if all Black community members who test positive for HIV were linked to intensive case management within 72 hours of their diagnosis, so quickly? And what if they could receive that care close to home in Scarborough? Right now, there are no HIV services in Scarborough. You have to travel all the way downtown for HIV services. What we came up with is the IA Circle of Care, which is an intensive case management HIV program. It's a clinical program. And we've placed that program inside of Taibu Community Health Center, which is a health center that serves Black people. And it's in Scarborough. It is the first HIV clinic for Black people in the province of Ontario, but it's a research study, it's a pilot. We've placed a nurse practitioner, an advanced care RN, a peer navigator to help address those social determinants of health I was talking about, and a social worker to help with the case management. This is the first time I've actually received funding that has allowed me to equitably partner with the community, and the community actually got more money than I did as a researcher, because this whole team is funded through the research study. I will not talk to you about how difficult it was to convince the funder, right, to prioritize those clinical positions. Our goal is to lower the percentage of Black. We want to lower the estimated number of days it takes to get someone on medication and get that first viral load test. We want to reduce the number of days it takes to suppress someone's viral load, because if their viral load is suppressed, they cannot transmit HIV to people they love. And we're going to reduce the number of new HIV infections in the Black community in a Black neighborhood that has a high rate of Black people. I wanted to leave you with something positive, right? In terms of, you know, our research can do incredible things and leave a community with something. And so my goal with this project is that we will do the advocacy to show that we need this, and that we're going to leave the Black community with an HIV clinic that is designed specifically for them, and acknowledge that we have the highest rates of HIV in the country, and therefore we need the most amount of resources to address it. And I hope you all take something from what I've talked about today. And hopefully this is just the beginning of a dialogue that is much longer.
Thank you so much, Dr. Massaquoi, for that wonderful presentation. I know that we have 5 minutes left, so I certainly want to take the opportunity to invite those on the call to either raise their virtual hand or to pose their questions in the chat box. I'll make sure to bring them to the attention of Dr. Massaquoi, but I'm just enthralled with everything that you presented today. Are there any questions out there for Dr. Massaquoi? Oh, go ahead, Sasitha.
Thank you, Dr. Massaquoi. I don't have a question. I wanted to say that I've been a fan of your work and followed your work for
I was just going to say the
many
same thing
years.
to you.
Oh, really? Oh, that's surprising, but thank you. Yeah, I was just telling Priscilla last week, and I probably have said so before, but anyhow, I followed your career from Women's Health and Women's Hands and for many years, and seen you on Twitter, like advocating so fiercely for Black health, and I just find it really inspiring. And I wanted to let you know that for many years. So I'm glad I had the opportunity to tell you that in person. Actually, I guess I could ask you. I actually have one question now that I'm talking about it. If no one else has a burning question, I was actually wondering if there's any. I've been following also the EGAP framework and the need for Black communities to like own their data and have like a say in how it's used. I was wondering if there's any tension between obviously the need for that, but also like if a researcher is not from the community and doesn't own that data, but wants to be involved in that process, does the ethics board have an issue with the ownership going to the community versus the researcher? Because that seems like not typical in my understanding of how it makes sense.
You're absolutely correct. You know, and I'm working through that for the first time with this Women's College Hospital data that I was talking about. And so you're right. No, the community can't own the data. And so what we have to do is develop a process where I am the custodian as the researcher, but I have a whole national committee, for example, in this case, of Black women who are researchers and women living with HIV who manage the data.
Okay.
And we have written agreements, and we're literally working through that process for the first time. And I think we're marrying, and I'm so grateful for our Indigenous communities who already have a process in place. And so they've been really supportive in terms of helping me think that through for Black communities. And I encourage other communities to think about this as well, so that you have ownership, you have analysis, all of those things coming from your community on data that you may not have collected, but will impact you.
And was that with the REB in Scarborough, or in case that is like something that if something like that comes up for us, we can reference that this has happened elsewhere?
That's right. So Women's College Hospital directed the REB, but it's the U of T. It's U of T in general, but Women's College Hospital has its own REB process as well.
Okay, great. Thank you so much.
Thank you, Sasitha, for the great question. I'm just looking at the clock. We've run out of time, unfortunately, for this community engagement series event. However, I'll be circulating an email after today's session with a recording of this event, as well as the email contact for Dr. Massaquoi if you'd like to reach out directly and ask any additional questions you may have about her work or today's presentation. And a big thank you to everyone on the call as well for joining us today. This is our last event for 2023. We certainly look forward to seeing you in the new year, and we'll be announcing our next groupings of presentations in our January newsletter. So thank you very much, everyone. Have yourselves a wonderful rest of the day, and certainly look forward to seeing you again. Bye now.